Just a quick take on this Lancet study that leaves us startled that 70% of Indians, shockingly, are antibiotic resistant. What does this mean for us in the long run?
Thank you very much for giving me this opportunity. But I'd like to highlight that this particular study is on the tertiary care hospital-based study. So it really doesn't, you cannot just assume that the same scenario exists in the community and same, it is a simple one hospital-based study, although it is a multi-centric, done in Italy, Netherlands, and US. And of course, out of those, in the study also, the highest burden has been shown in India. So I think that is well taken. But having said that, there are many other areas which need to be explored as far as surveillance is considered, as far as the hospital use is considered, as far as the community-based use is considered. But yes, you are very right, and you have very well, in your introductory remarks, you have very well highlighted the problem which we are going to face in the near future or in the years to come, when we will be left with very few antibiotics, and particularly the persons who are consuming irrational type of antibiotics, irrational use of antibiotics by the doctors. So there are a number of factors. And yes, the government is not really silent. The National Antibiotic Containment Program, it has also been highlighted by the Honorable Prime Minister of our country, and it has got very strategic 6 pillars on which the government is acting. But yes, the efforts are really minimal, and they need to be really complemented by the efforts not only in the government sector, private sector, veterinary sector, agriculture sector, food sector, and it's a multi-sectorial origin. So efforts have to be multi-sectorial also.
When the study says that India is the epicenter of a global superbug explosion, what does that really mean? What is a superbug?
No, superbug is basically the multi-resistant bacterium which are not responding to the routine antibiotics or the antibiotic which are being in common use for those particular, say for respiratory infections. If we are using the routine antibiotic, they may not really work when the resistant bacterium emerges. And that resistant bacterium can emerge due to mutations, due to, we have seen in COVID also, we have seen in many n number of infections which are like staphylococcus infection. So there are now resistant to in tuberculosis also, MRSA, multi-drug resistant XDRA-TB, MDR-TB. So all these things are really forcing the doctors to resort to stronger antibiotics. And on the other hand, we have very limited new antibiotics or new antibiotic molecules which are emerging, which can help us in these kind of scenarios. So definitely there is a definite warning for all of us that we need to be cautious. And this study definitely points, although it's a hospital-based study, endoscopic ERCP, post-ERCP patients, but definitely it points, it's a pointer wherein we need to take actions on various fronts. Number one, we need to assess the correct burden of antibiotic resistance in the country. That is one. Second, interventions from the community to the top level, up to policy level maker. We need to have clarity in the policy, clarity in the prescriptions, and strict enforcement of the policies or the
Doctor,
interventions which the government has planned.
yeah,
Yeah.
surely, do you believe that doctors are being forced to prescribe powerful antibiotics, or you believe that doctors, I'm sure you would disagree, but are doctors prescribing it for flimsy reasons which can be avoided? What would be your advice?
There are two aspects. Which first thing you have said that doctors are being forced. I don't see that there is any regulation from the government side or otherwise also which forces the doctors only to prescribe a particular medicine or antibiotics. I don't think that there is any
No,
reason for
okay,
delaying.
maybe
Yeah.
if I could rephrase this question, and I'm sure not all doctors are tainted, but there was a news piece that came out a few years ago, or maybe barely a year ago, that Dolo 650 was a tablet that was, the company itself pumped it into hospitals so much and paid a certain amount of money for hospitals and doctors to prescribe it to patients. So,
Yes.
example that.
No, that is. No, I think you are very right as far as companies advocating going to the doctors as a medical representative or as a otherwise also giving them some incentives, and which is forcing or which is rather becoming a sort of a incentive to the doctors to prescribe those particular medicines or those specific antibiotics, because they want the sale of that particular antibiotics increases, a company benefits, and company in turn passes on some kind of benefit through XYZ routes to the doctors. So that was the reason behind that particular episode which you are talking about. But as far as the regulation or as far as the compulsion is on the other front, I can say. It is not definitely no, that the doctors are being forced to that particular doctors. Maybe rather
Okay, okay.
become,
A quick word
yeah.
of advice on how you can, maintain your immunity to ensure that you're not resistant to antibiotics when you really need them.
No, I think it's a multi-sectorial effort which needs to be put in place. Number one, infection control practice on the hospital front. We have to have the strict infection control practices which have to be followed by not only doctors but also with regard to the nursing care and others also. That is one. Second, on the public front or the persons who are receiving antibiotics, I think what you have highlighted in your introductory remark, we can go in for that particular antibiotic this time also. That particular practice needs to be curbed with a strong hand. Third, we should not, but for pharmacy, they should be advised not to sell that red light campaign. I think you must be aware about the
Yeah.
red line campaign, that the antibiotics should not be sold over the counter just on the basis of some pharmaceutical knowledge, because it requires the knowledge
Correct,
of the
correct, correct.
infection with which the person is suffering, and then you have to go. Third, which important is that if at all doctors feel that there is a need for antibiotic, I think culture sensitivity needs to be done. And once the culture sensitivity results are obtained, you should not be unnecessarily going in for the antibiotics which are showing resistance.
Yeah.
We should be using the antibiotics to which the bacterium in that particular person is highly sensitive. So I think that will definitely help us in a big way.
Great.
But
Yeah.
there are many efforts on the pharmacy front also,
Yeah,
community
we're
also.
looking
Yeah.
forward for the system to be fixed, and I'm short on time on that. Thank you very much, Doctor. I really appreciate for coming on board for this story with your expertise.